So, good morning. I hope you all, this is Leslie Tarkington, Chair of the Budget Committee, and we have Leslie Moriarty, Harry Fisher, and David Weisbrod. We welcome you to our February meeting, which we changed to begin at 10:30 from 1 o'clock due to the snowstorm which we had and Town Hall being closed yesterday. A lot of reorganization was done for our meetings, including HR and now budget. And then we'll continue after a mini break with day 5, which was postponed from yesterday. So we have 2 budget requests on our agenda today. The first is from our police department. It's PD2 for $11,460, and it's an approval to use. And it says a feasibility study, but I thought it was for 2 printers.
No, yes, 2 printers.
I think we need
No
to,
study needed.
I think we just put this down as like equipment. Roland, we'll change that one for our next meeting.
Okay, so the state of Connecticut has a 911 fund, which is basically a grant that is provided to all public safety dispatch centers in the state. They provide upwards of $20,000 a quarter for replacement of equipment and paying of any sort of, that's pretty high, I'm sorry. It pays for any sort of, anything that happens within the 4 walls of dispatch. This is how we're doing our dispatch revamp that we're in the middle of doing. 2 things that were left off the list for the dispatch rejuvenation project are these 2 printers that have been in service since 2009. So the fact that they lasted 14 years is pretty impressive. But these 2 main printers are the printers that all of the state teletypes, NCIC, Collect, which is DMV. We get blowback pictures from Department of Corrections on mugshots and all sorts of other things. That is, teletypes, everything from the state goes through these 2 printers. They're 14 years old, they need replacement. We put in for the 2 printers and a bunch of toner, which is quite expensive, so we might as well include that as well. The total is $11,460.44. And we're here today to ask for permission to utilize the grant to pay for these.
Any questions?
So this is a very substantive question, but I'm just curious why you're ordering 1 green and 1 yellow.
Because it's very rare that we use color. Very rare. So I have no other answer for that.
Thank you.
Do we have any other questions? I would like to comment on one thing. This is not a question, but I was very impressed by the cost of your toner project.
Oh my God, yeah.
I mean, I have an HP printer, and I can tell you I buy these toner project, packages from HP, and I thought mine were expensive, but wow, these are really.
Yeah, they're really large and they last a long, long time. And they're commercial grade stuff and they are insanely expensive. That's why we felt that it would be best for the grant to pay for it than our budget.
Yeah.
Very good.
So because of the issue where Town Hall was closed, so while everything was posted on our town website, it wasn't physically posted with Town Hall closed, these meeting changes. So we're just going to take our vote. We've reposted our votes for 1 o'clock tomorrow. So there's no question about that. So we thank you. You do not need to come back tomorrow. But we're going to just do all of our votes tomorrow morning. I'm sorry? Tomorrow morning at our meeting. Do we need one more package?
One more.
Thank you.
I don't need that.
So,
Can I just suggest we do a straw poll so he knows our indication on
okay,
those?
so I'm going to take a straw poll of the Budget Committee so you have a feel of what's going to happen tomorrow. But you can also, we're available on Channel 79, if you're Optimum, 24 if you're Verizon, and GCTV YouTube, if you want to see the actual vote. But I'll take do I have a straw motion?
Just say, those who are going to approve.
What? Okay, so,
Not a motion,
okay.
so.
So those who would be in supportive of this?
Yeah, could I further suggest that it probably be routine?
Okay, so we're thinking this might be routine when we take our vote, and it looks like when we just sort of kind of feeling the field, that there'll be unanimous support for this. And we thank you for coming.
Thank you so much. That's wonderful. Have a great day.
Thank you. But, I mean, I must say, those toner packages are expensive. And so our next item is Human Services. And so we asked you to come up. And, you know, Mary, we're going to just finish this meeting, which is almost finished. We're going to take a mini break, and then we're going to start a meeting. So it's probably going to be 10 to 15 minutes max, just so you know that you're now in the Budget Committee meeting. Okay, thank you. Thank you. Okay, so we welcome Demetria Nelson and the Department Head for Human Services, and Tyler Fairbairn, who heads up our, I guess, grants and community development block grant. And so they have a proposal for $73,169, and it's approval to use opioid settlement funds that have been coming in fairly regularly now, and probably in, you know, substantially larger amounts than any of us had ever expected. Is that correct?
It was expected for the distributor's settlement for that to happen over a course of 18 years, and now we have a better idea of what each yearly payment will be. So it's about $25,000, but we did have a lump sum payment for the Janssen for $99,000. And there are still 2 other settlements that we will be receiving in the future.
So, but this is it fair to say this is more money than we ever expected to get?
Not this, no, we expected this amount from these 2 settlements, but I was not expecting the 2 future ones that will be coming. So, yes, once I have a better idea of how much, then I can provide that information.
Okay, great, super. So why don't you explain again how your plan that you've presented for the approval to use the grant money?
Yes. So there's a list of opioid remediation uses where any use that you have identified must fit within that use that prioritizes prevention, treatment, harm reduction efforts. So Tyler and I initially met back in November around 2022 with many of the key department heads in the Department of Health, Greenwich Police Department, the Commission on Aging, also GEMS was involved, the fire department, as well as our 2 departments. And we first asked, are you currently using funds that would meet the criteria for the remediation uses? And we were able to find a few, and I'll go over that in a moment, within GEMS and also the for the police department. And we also know that within my department, we do fund addiction treatment services through providing funding for liberation programs. Then we took a step back and looked at the fact that we have a prevention coalition within our town, and that is Greenwich Together, and they already are involved in prevention efforts, and their funding for certain efforts fluctuate, so we looked to see where there was a hole or a need that we could meet for them. And then we all decided, especially when we got the lump sum payment for the Janssen settlement, that we would reach out to the Board of Education to see if they had any needs. So what I'll go over with you all Tyler, would you like to start? And we can review where we are going to be using the funds. So if you turn to your presentation, where it says FY 2024 planned use of settlement funds. I'll let Tyler go over the first page.
Sure, yeah, so these were the result of our meeting with some town folks and then with the Prevention Council. The first page will detail, which department within town is going to be handling that particular thing, the intended use with the grant funds that are coming in, and then the remediation use item is where we kind of aligned it with what the list of approved uses that the settlement offered were. So you can see we have, various both prevention and purchase of things like Narcan kits, for GEMS and for the police department, as a way to just kind of maybe take some of that funding away from where it had previously been coming from and use the grant for it if that funding is available.
And in addition to that, the police department also destroys any unused medications, and some of those are also opioids, so they are able to use funds for destruction of those type of medications for the drug take-back day or any other day when those drugs are collected. And specifically for Greenwich Together, they were formerly able to provide lock boxes so that families, households could have a lock box where they could store their medications out of the hands of vulnerable individuals within their household, but they no longer had funding for it. And that expense also fits within the remediation use. And also, Greenwich Together will be starting a media campaign specifically targeted, related to opioid misuse among adolescents and the general population. And then if you go to the last page of the presentation, you'll see the requests from the Board of Education or Greenwich Public Schools. All of those requests do fit within the remediation use list, and they include a big chunk is focused in on providing education to teachers and nurses that are required. You'll see also that there is a small amount that will go to purchasing Narcan kits that will be available within the schools. And then also implementation of an evidence-based practice that allows for screening to identify if there's a risk for substance misuse, and that is called SBIRT, Screening, Brief Intervention, and Referral to Treatment. And yes, we tried to lay it out as clearly as possible for you so that you could see the connection between what the request is and the fact that it meets the criteria for the remediation use list.
Thank you. It was a very good package, so, I thank you very much. Do we have questions? Harry?
Okay, so, forgive me if I'm slow, but I gather all of this money is going to other departments, not anything within your department, or is some of it being spent within your department?
Within my department, technically only the $5,000 for liberation programs to assist with their funding for treatment.
But that's going outside of your
That's going
department.
outside.
Right.
Yeah, there isn't any that's going internally
Okay.
into my department at this time. Not that that won't happen in the future, but I didn't see the need this go-round.
Okay, thank you.
Thank you.
Leslie?
Two things. One is some of this fund is being used to offset previously approved budget items. Because they've been previously approved, I'm surprised, is there a need for the additional funding that rather than supplant what we had planned and approved to spend to add additional funds to those programs? Did you consider that, and why did you decide to not appropriate it that way?
Yes, so for those, anything that would offset the costs that are already on someone's budget, we did focus in on those things like Narcan supplies, something that you will run through that has a limited time period, where it's either 2 to 3 years for the expiration date, so they will need to replenish those funds. So we tried to balance funding existing programs or ones, and then also with those that no longer had funding, and for some new programs. You can see all of the funds for the Board of Education are all things that aren't in there.
They're new, but
Yeah.
the first four under year one distributors funds are all offsetting Greenwich expenses as opposed to adding additional sources. And it's just the last one, which is Narcan kits. So, so you have $10,000, which potentially you could have used for a different purpose, and you chose not to.
Yes, and I think moving forward, what I am going to do to better align this with the budget process is that we will meet with that core group that I mentioned in October every year. So as people are getting ready to put together their budget, or maybe even earlier, so that we can have it approved as they go into the budget season.
So
I know,
that,
but your goal, what you're doing is you're reducing the town's expense in this area by using the outside funds as opposed to taking the opportunity to make, I don't know if there's an unmet need out there. But, so I think I've made my point. But, and then the second issue, there's a lot spent on the training and the communication of prevention means, not as much on treatment. Do we have less of a specific issue in town that you've chose that balance as opposed to maybe more treatment-oriented spending?
Yes, we actually do have a relationship with Liberation Programs that they have separate funding for an initiative where they are able to provide case management services for a family if there is a death by opioid poisoning or if someone has an opioid overdose. They can connect them to treatment. So that funding is already in existence because of that COSAP grant that Liberation Program has and provides us with services through their wellness van and their teams, and in collaboration with the police department.
And the level of service they provide is sufficient for what you see our town requires?
Currently, yes. So right now, in 2023, we had 6 opioid-related deaths. And so for us, that number, it had gone up about 2 from the previous year, but right now the services do meet the needs, but I think we have to reassess every year and direct those funds as needed.
I think that was part of our conversation with GEMS as well.
You take the mic over?
Yes, sorry. This is one of the things we discussed with GEMS when we first met, was that at the moment there seemed to be more of a need for prevention and education than direct treatment, because it was a relatively low number of actual overdose incidents.
And can I ask one follow-up?
yes.
Just related on the screening, brief intervention, referral for treatment.
Yes.
That's actually a program for individuals, or is that more education? It's hard for me to understand.
Yes, that is a brief intervention that is a treatment program. It's an evidence-based practice where someone is universally screened to see if there's evidence of substance misuse, and then there's a determination that's made to see if that person needs a referral for ongoing intensive treatment, or if there can be a brief 2 to 3 or so, and that's just a number I'm throwing out there, of brief interventions by the provider that is doing the initial screening.
Thank you.
No problem.
David, do you have any questions? You don't have to then. I have one question, just about the new, the Board of Education one. Do we have Narcan now in all of our schools? I mean, not that you would necessarily need it at the elementary level, but, you don't know about teachers or other aides or whatever, that work, people in the school system. So do we now have it at all of the schools?
I don't know if it's at all of the schools right now, but I know that these funds will permit for that to happen.
So that's the purpose of the funds, to permit that to happen?
Yes.
Okay, great. So we're not taking votes as such at this meeting, but can I have a straw poll? Is this a routine item? Yes.
Yeah.
And those in favor?
Yeah.
Okay, so we're going to take a vote tomorrow at approximately 1 o'clock. You can either come and wait. You have a good idea what's going to happen. But we're doing this to accommodate the town's snow day yesterday, when we moved the time up from 1 o'clock to 10:30. And then because of the snow day, they weren't physically posted, although it's all online the previous day. There's no issues with any of that. So we're taking a vote.
One question, if I could.
We finished with the vote.
No, it's fine. The vote's fine, but I still have a question. Just the block grant, the conduit through which the block grant comes is through where? It's the Jansen settlement, but then how does it turn into a block grant? What-
This isn't a block grant. You're just helping, right?
Yeah,
Part of the committee. This is not block grant.
It's not in any way a block grant. I'm just
Not related to CDBG, it's a different kind of, I'm hesitant to even call it a grant. I mean,
It's
really
a settlement.
It's
a legal
settlement funds.
No, I know it's a
yeah.
settlement, so it's purely a settlement that, I just wonder the mechanics of how it gets to us.
I believe it just gets wired right to the town.
No, the mechanics of, so this, a settlement has been reached in court,
Yep.
and then the settlement dictates that the money goes where? That's the.
It's here. It's right in
Yes.
this very extensive information.
No, I don't mean the uses. I get all that. I'm
Right,
just-
how does it get from
Yeah.
court to us?
That's my
Yes,
question.
so there was an initial agreement that we had to sign as a town, that the first selectman signed after our law department reviewed it. And then they agreed with the finance department in terms of the wire transfer, and that would happen on a regular basis, based on the payout schedule.
And individual municipalities had to opt into this, I believe through the state.
Yes.
And so then once, you've informed the state that you're participating, you arrange to have the payments come in.
I think this was all reviewed by our law committee, et cetera, at the time. So I think thank you very much, and now we're going to move on to.
Thank you very much for having me.
Thank you for your time, everyone.
And we'll take the vote tomorrow, 1 o'clock. You can watch it on YouTube, wherever you want, or whatever, okay? Or you can come, or whatever you want to do. Okay, so Roland, we have an economic conditions report. Do you want to run through that? I see, like, conveyance taxes, they're still very strong, very strong.
You might,
We're kind of the same as we have in the last few months. I mean, taxes are up almost $9 million over last year. Interest is 2.7. Building permits is 700 over. The penalty for the selling the home before the 10 years is up. It's still 600.
Public Act 490, is that what we're
What's
talking
that?
about?
Yeah, is that
Public Act 490, right?
right? And bridge revenue is 1.2 million over last year. It's offset by, we haven't received any money for LoCEP or CMAQ yet, which is down 1.7 from a year ago. In terms of the expenses, we're still the same, Board of Ed, Special Ed, and the bus contract is still out there ahead of last year. And then we have insurance, 700, pension and OPEB is 2, healthcare is 2, and we transferred $4 million more into the Z fund. We're paying capital with the tax
So
levy.
Roland, I noticed that in the last few months, you've had a nice little table that you have provided us, but in this particular one, there isn't a nice little table. You think you could just follow up and send
Sure.
a nice little table? That would be great, thank you.
what was in the nice?
There's just a little summary of where we stood, pluses and minuses,
Oh,
just critical.
Okay.
It wasn't, all as detailed that Roland is just, but I think it's good to have that. Any other questions? No. So, is there any reason to discuss any of the meeting minutes that'll be voted on tomorrow? Okay, so, there is, other than, having described that we'll take the votes in tomorrow's meeting scheduled for 1 o'clock, there's no, it will be, what we'll do is we'll break from day 6 for a quick meeting and then return to day 6. So is there any motion to adjourn?
make the motion to adjourn, 10:56.
Second.
Okay, motion to adjourn at 10 by Leslie Moriarty, second by Harry Fisher. Those in favor? Aye. So, thank you very much. This is the end of this meeting.